The patient puts a lot of trust in me and what I know and what I'm telling them is best for them. And so it's important for me to get to know them to establish that trust. And I think that that's important not only for helping them get better, but also for establishing a good bond with the patient. I grew up, as an athlete, and I was fairly healthy as a kid, and I usually only saw my pediatrician if I got hurt and for checkups, and so that was kind of the only medicine that I knew in the beginning. And then I realized that sports medicine and taking care of athletes and musculoskeletal injuries was a field, and that was exactly what I wanted to do. Some of the things that we see in clinic are knee injuries, shoulder injuries, ankle injuries, soft tissue strains, muscle strains, tendinitis, overuse injuries. But we also see a lot of growing pains. We see a lot of kind of growth plate injuries, a lot of fractures, and concussions. If you're working with a pee-wee football player, it's that may be their favorite thing to do in life, and so they take it very seriously. Their family takes it very seriously, and so understanding that is just as important as understanding a professional athlete that has to miss part of their job with an injury. And so realizing the age of the patient, the common injuries that present at that phase, and then also the goals and what needs to happen to get back. I think that it's a very rewarding field. We see a lot of patients every day, and so there are a lot of success stories that we see each and every day, which is great. There's a lot of smiles that we put on people's faces. I think ultimately, at the end of the day, being able to say that I did the best thing that I could for each and every patient really is why I got into medicine.